My name is Caleb Hoover, and I'm a PGY1 clinical pharmacy resident at a Level 1 trauma center. Today I'm going to be discussing a stepwise approach to APPE selections. And for those of you unfamiliar with the term APPE, it stands for Advanced Pharmacy Practice Experiences, which comprise the majority of the final year of the Doctor of Pharmacy program, also known as the PharmD program. Now, because APPEs occur in the final year, this video is going to be catered specifically to students in their third year, about to enter the process of selecting APPEs, and I hope that it's also beneficial for any pharmacy faculty looking for a way to communicate a stepwise thought process that students should be using as they begin their rotation selections. Now, within this video, I will be discussing my own stepwise approach that I developed and used for selecting my APPE rotations, and I will also be providing a practical example from my rotation schedule that I did in my final year of pharmacy school. Now, why do we have APPE rotations in the first place? ACPE, which is the Accreditation Council for Pharmacy Education, is the organization responsible for accrediting schools of pharmacy, and one of the key components to meet accreditation is to have a strong APPE program. ACPE has guidance documents, and they state that APPEs are designed specifically to integrate, apply, reinforce, and advance the knowledge, skills, attitudes, abilities, and behaviors of pharmacy students, which will be building on the foundational knowledge that they gained in the first 3 years of the PharmD program. The ultimate goal of the APPE year is to train students to be equipped to effectively enter pharmacy practice as competent pharmacists upon graduation. Now, within the guidance documents, ACPE sets out strict standards that must be met in order for students to graduate with a PharmD degree. APPEs must comprise a minimum of 36 weeks, equivalent to 9 months, of full-time rotations, and each APPE must provide students with at least 160 hours of experience in a particular area of pharmacy practice. This equates to at least 1,440 hours over the course of 9 rotations. Now, in addition to these requirements, ACPE has 4 standards and domains that must be met as well, including practice settings in the areas of community pharmacy, ambulatory care pharmacy, also known as primary care, hospital and health system pharmacy, and inpatient general medicine patient care. Now, in addition to those, pharmacy students are to select elective rotations in order to mature professionally and to secure the breadth and depth of experiences that are needed to successfully practice pharmacy upon graduation. So in summary, APPEs are purposefully designed by both ACPE and schools of pharmacy to provide students with a wide range of practical experiences to be well-rounded upon graduation. Now, how does the actual APPE selection process work? Every school of pharmacy has a different process to assign students to APPE rotations, with some schools providing more scheduling flexibility and ability to cater to individual preferences than others. It is very important to review your school's policy and to review it early in order to have the best chance of obtaining APPE assignments in rotations that align with your interests. For example, my school's APPE process occurred like this. First, we selected preferences for regions of Ohio that we wanted to practice in, like the Columbus region, Cleveland region, Cincinnati-Dayton region, and Southeast Ohio. Then after being assigned to a region, we were able to rank specific rotations within that region, and the experiential department compiled everybody's rankings and then assigned sites to students. After this, they also provided a 1-week time frame where we could request adjustments to our schedule based on any available rotations where students had not yet been assigned. We also had the opportunity to choose APPE rotations outside of our state, and not all programs are designed this way, so again, it's important to review your school's policies and procedures in advance of the APPE selection process. There are many considerations to think about during the process of ranking and selecting rotations, and my goal for the remainder of this video is to provide a stepwise process that can be used as you start APPE selections. So what's the first thing that you should think of? You should identify areas that you already know. Here are a few questions that I think are helpful. First, what areas of pharmacy practice have you experienced during your APPE rotations, which are your introductory pharmacy practice experiences that occur during the first through third years of pharmacy school? And what experiences do you already have at work? Do you have retail experience, independent pharmacy experience, inpatient pharmacy experience? Did you get a good taste of that practice area of pharmacy, or would it be beneficial for you to complete an APPE or a focused 1 month in that setting? If you already have experience and are comfortable practicing in the identified areas, I would encourage you not to select an APPE that's in one of those areas if possible. As I mentioned earlier, there are required domains for APPEs that must be completed, and ACPE is very clear and has those lined out. However, there are numerous practice settings within those domains that can enable some variability in your rotations. So after identifying what you already know, you need to identify areas that you want to grow in. What areas do you need to grow in? Keep in mind that the purpose of APPEs is to prepare you to be practice ready by graduation, meaning that you're able to function independently once you pass your boards and are licensed. An additional consideration is that you will be taking the NAPLEX exam at the end of graduation, and that exam encompasses information from all areas of pharmacy practice. So, a benefit of having a diverse schedule, it will aid in your preparation for the content on the NAPLEX exam. Pharmacy encompasses thousands of drugs for thousands of disease and illnesses. Stepping out of your comfort zone and entering complex scenarios is going to significantly challenge you, but it will also significantly stimulate your growth as a professional. So with that in mind, ask yourself some of these questions. What areas of practice am I weakest in that I want to improve by graduation? What do I want to learn more about? What settings of pharmacy practice am I interested in? What settings are available to me that I might not be able to experience after graduation? APPEs are a great opportunity to explore new areas of pharmacy practice and to develop additional skills that will be crucial to your success as a pharmacist. So after identifying the areas that you want to grow in, review available rotations. Review any details that your preceptors provide about their rotations. What do APPE students spend their time doing at that setting? Is the rotation designed to be hands-on, or will you be spending more time away from direct patient care areas? It's important to keep in mind that simply because a rotation is labeled inpatient pharmacy practice doesn't mean that you will always be interacting with physicians or nurse practitioners or nurses or even patients. Review the organization's website, and specifically, what information do they provide about the pharmacy department? Is the site recognized for a particular area of pharmacy practice that aligns with your interests? What do you know about the site or rotation from peers or from professors? Did any recent graduates have a positive or a negative experience at that site, and find out why that was the case? One of the most important questions is, how is the rotation going to challenge you to become a better pharmacist? Now, an additional consideration when reviewing rotations is also their location in proximity to you, wherever it is that you will be living, or maybe you will be traveling to in order to complete special rotations. While I don't recommend solely basing your choices on location, simply because it's going to limit your options, I recognize financial and family factors influencing your choice. I would encourage you to find a healthy balance, whatever that may look like for you. This can be very significant to consider, especially when you factor in how travel time, for example, takes away from the ability to perform other responsibilities and obligations, whether that's to your rotations, to your home life, to your work. Envision the future. In addition to gaining experience, a crucial aspect of APPEs is connections. APPEs not only enable you to practically apply the content that you've learned in the classroom and make that bridge between academic knowledge and practical experience, they also afford you the opportunity to network with pharmacists and residency program directors at sites you want to work at after graduation. Think about these rotations as a 1-month-long job interview. You never know how your interactions, both positive and negative, as well as your effort, is going to pay off in the future or impact you in the future. Will this site foster connections that can be utilized in the future to jumpstart your career? Are you considering this site for a possible residency in the future or a possible future job placement? There is more information that I can discuss and that I plan to discuss in a future video about preparing specifically for residency, but keep in mind that APPEs can provide you with more opportunities than you may realize, so choosing sites can have a significant impact on your next steps after graduation. That's why this process is so important to get right. You also want to optimize your off months and plan accordingly. Plan them strategically. Use that time to your advantage. You may find it beneficial to schedule off months in order to break up your rotations. So, for example, I took off August and December in order to have 3 months of rotation followed by a month to relax or work on other things. Also, consider how you can best utilize your time off. December is a great month to finalize and submit residency applications, which are generally due by the 1st of January. February is typically the month when most residency interviews take place, which can be anywhere from a couple hours to a whole day. And April is a great month to study for the NAPLEX and MPJE, which is the law exam. And some schools of pharmacy also have review sessions and certain weeks during that time frame that you're expected to learn additional information as you approach those exams. Now, finally, if you have the ability to rank your sites, rank them in order of your preference, not anyone else's. Don't let the decisions of your peers heavily influence your decisions. And again, remember that APPEs are about your personal professional growth, and they should be tailored to you as much as possible. If you're anything like me, you have a variety of interests within pharmacy, and you can see yourself enjoying multiple areas of practice, or perhaps you have no idea what you want to do. So my recommendation for you is to do everything possible to make a diverse rotation schedule. That way you can capitalize on APPEs and explore unique areas of practice. Look for a balance of retail pharmacy, like chain or independent, ambulatory care, which is primary care, managed care, hospital rotations, also populations that may be unique, whether that's low income or certain disease states. Here's what you don't want to do. There are some colleagues of mine who designed their rotation schedules to be heavily critical care or cardiology focused, only to realize that they didn't enjoy those rotations and they didn't want to practice in those settings of pharmacy. This significantly limited their ability to experience other areas of pharmacy that they may have enjoyed more. So it's crucial for you to explore areas of pharmacy that you have no experience in, because who knows, you may even end up with a clear direction for your future. So what does this look like practically? While my schedule that I'm about to present to you is not a perfect example of a diversified rotation list, I think it demonstrates the ideas that I just presented. So here is the list of rotations that I completed in my final year of pharmacy school, and I'm going to be going more specifically into this list in the next slides. So for my inpatient rotations, I tried to find a good balance of various specialties, such as cardiology, neurocritical care, infectious disease, internal medicine, and I also had a general inpatient pharmacy rotation. Now, I chose my neurocritical care rotation because it was at a site that I was considering for residency, and because of my work that I did in that rotation and how I presented myself, I think it was a key component to me securing that residency, which is what I'm in right now. Another rotation was an outpatient oncology rotation. This was an area that I felt weak in within pharmacy school and wanted to have a focused month to further understand and learn the oncology content that I will be required to use as a pharmacist. I had a lot of chain retail experience, and so I wanted to experience an independent pharmacy, as well as community HIV pharmacy, which was an option for me. I also felt weak in the department of HIV, meds, and patient management, and this was an opportunity that I saw to improve that area of my clinical practice. And then my last one was an ambulatory care practice setting where I focused on managing patients with chronic disease states such as diabetes, hypertension, COPD, and more. Now, I already told you a little bit about how I scheduled my off months, but August and December were to break up my rotation schedule so that I'd have a break. December, I used a lot of that time to prepare for my residency applications and finalize those. In February, I used in order to have my pharmacy interviews conducted, which ended up being very beneficial to have that time off just to focus on my future once I graduated. Now, in review, the stepwise approach to APPE selection that you should be using, or at least modifying, as you approach the selection process is first, identify the areas that you already know. Don't duplicate rotations if you're already confident in that area. Second, identify those areas that you want to grow in and primarily select those rotations. Third, review available rotations, find out as much as you can about them to determine whether or not it will be a good fit for you and challenge you. Fourth, envision the future. Look for rotations that are available at sites that have residencies or a job that you want to pursue upon graduation. Fifth, optimize those off months, use them well to relax, but also to prepare. And finally, rank your preferences and hope for the best. Now, if you have any questions, please drop down a comment. I will read those and respond to them. Let me know if there's anything you'd like to see me talk about in the future, and I hope that you are successful as you select your APPEs. Thanks.